Elaine Keegan.
Pleasure to serve under your chairmanship. 1 in 9 young people aged between 5 and 15 has a diagnosable mental health condition. So I want to thank my honourable friend, the member for Burton, for securing this vital debate. And the issue becomes more pressing as figures suggest that these children are twice as likely to carry mental illness into adulthood. But the government are obviously taking some action. They've invested £1.4 billion to improve specialist services for mental health, but of course we're playing catch-up. Pressures on the younger generation are at a new high with the advent of social media. There is a constant pressure to keep up on platforms like Instagram, Snapchat and Facebook, and this is compounded when we look at their exposure to image and celebrity culture. And while social media has the power to be a power for good, it's all too often clear that these platforms can have a detrimental impact on children's mental health. And we've already had some truly devastating cases, such as Molly Russell, whose suicide sparked this important conversation nationally. And I welcome the current review underway by the Chief Medical Officer, Dame Sally Davis, who is assessing the impacts that social media has on a child's mental health. Another mental health condition on the rise, especially in young people, are eating disorders. And I recently met a constituent, Lizzie Speller, here in Parliament with the charity Beat UK. They support people with eating disorders, and Lizzie herself spent several years fighting anorexia. And when she overcome her long battle, she did get the help she needed. And I think it's fantastic that 4/5 of young people with eating disorders do now receive treatment within just 1 week. And Lizzie is doing a lot now to help other people. She has set up mental health mates walks, a Chichester community group, which has a monthly city walk. My husband and I joined them earlier this year. And it's an ability to just meet and talk about things that concern you. The role of Beat is important in overcoming, in spreading this network across the country. Another Beat ambassador is my goddaughter's sister, Isabella T. She herself worked hard to overcome anorexia as a teenager and is now working to support others at York University. Schools have a vital role in offering support and spotting signs where people need help, and many schools across my constituency, Chichester High School, Bourne Community School, to name but a few, have done a lot to support mental health in schools and have trained mental health first aiders and pupil mental health ambassadors. But on-the-ground visible services are exactly what we need, and I do look forward to seeing the impact of the new mental health support team pilot in my area as Coastal West Sussex CCG are taking part in the first wave. Getting to grips with mental health is so important, as the consequences of not doing so are unimaginable. On the 17th of July 2017, one of my constituents, Jo Marsden, had her life turned upside down when her 20-year-old son, Ned, took his life at Whitley Station. Ned had been excluded from school earlier in his life and over the years had withdrawn from his family and his friends. His mental health issues were well masked and not identified at school or later when his doctor tried to identify signs. And I've met Jo several times now, and she's an inspiring woman. She's created Ned's Fund that offers vocational courses to young people who drop out of school. And she said, my dream is to help as many children as I can by funding vocational training. I'm not a fairy godmother, but nothing would bring me greater happiness. And the impact of suicide on a young person is truly devastating. And my family knows this from personal experience when my young cousin Sally Gibson took her life some years ago. People across Chichester are continuously coming together to improve each other's lives, and tackling mental health needs a comprehensive approach where at every part of a young person's life someone is available to give a much needed helping hand. Thank you.